As open enrollment in the Affordable Care Act is now underway, there are a lot of new announcements of what to expect for the cost of insurance. Now, there were two separate announcements this week. The first one was that insurance premiums in the Affordable Care Act marketplace are going to be largely flat in 2020, not a lot of increase in premiums across the country. This is based on the approved final rates for about 28 states. The states that were very prompt in getting their filings in. The average requested rate increase was less than 1%. That's pretty good considering all of the market instability with a lot of political chatter and lawsuits over the last year. Now, the states that actively stepped in to support their markets are the states that actually see a decrease in premiums. And when we say actively stepped in, we're largely meaning that they implemented some sort of reinsurance program to help take care of some of those really high premium, high expensive users of the healthcare system. Now, we're here in Wisconsin. Wisconsin is one of the states that expects to see about a 3% drop in its average premium. We do have a new reinsurance program that is in effect. States like Colorado that have a very active reinsurance program and other measures to help stabilize the marketplace can expect as big as a 20% drop in their insurance premiums. Now, we said there were two announcements. The second announcement actually came out of the Centers for Medicare and Medicaid Services. They look specifically at the average premium for the second lowest cost silver plan for the average 27-year-old. They have a very standard metric of comparison from year to year, and this is the person that they look at to determine how prices are going up or down over the years. And looking at that very specific category of users, they put out a press release saying that they anticipate premiums to be down about 4% across the board. They advertise that there are about 20 more issuers participating on healthcare.gov. That's the federal marketplace for health coverage that's effective January 1st, 2020. That same press release, however, because this is still the administration that does not like the Affordable Care Act, even though they're charged with making it work, that same press release said, well, the Affordable Care Act simply doesn't work, but we're happy to announce that premiums will be lower for 2020. Now, we did say some states are taking extreme measures to stabilize their marketplace, and we wanted to take a moment to point out California going above and beyond to lower premiums in their state by doing enhanced individual mandates in their state. They don't just rely on the federal requirement that you have insurance or pay a penalty, because there's no penalty anymore, thanks to that being zeroed out in the last GOP tax bill. But in California, they have their own individual mandate, the state mandate that you have insurance or there be a penalty. Now, they also have expanded premium subsidies in the state of California, where federally the standard is that subsidies are available for individuals up to 400% of the federal poverty level. California went ahead and extended that to 600% with their own state subsidized version of subsidies coming through. Now, California runs its own exchange, which makes it possible for them to do a lot of these enhancements. Now, their enhanced subsidies for low-income families also help catch families on the lower end of the income spectrum. So they're paying attention to both the lower income families and those people that are just above that 400% threshold to make it a little easier for them to purchase insurance. Now, this, according to a lot of health policy experts, the enhancements in premiums being just a touch more affordable this year is despite that what they are calling the political sabotage of the last year or so. Things like we just mentioned, zeroing out that tax penalty for being uninsured by ordering that junk plans be allowed. That was an executive order by the president that said go ahead and sell short-term plans again, even though they're not comprehensive coverage. They can discriminate against people with pre-existing conditions, etc. The Trump administration also, once again, had cut marketplace advertising. Outreach navigators refused to defend the Affordable Care Act in court, stopped paying for things like cost-sharing reductions to make deductibles and out-of-pocket costs more affordable, stopped paying risk corridor payments to insurance companies, finalized a rule that allowed for discrimination in health plans against people with gender identity, and pushed for discrimination on other grounds, and then also offered the health reimbursement accounts, which also would pull healthier people out of the marketplace. So despite all of that, premiums are still going down, which left some health policy analysts to suggest just think of how low premiums could be if the Affordable Care Act was actually working as intended. Now, you can read in the description below that press release from the Centers for Medicare and Medicaid Services, their issue brief, and also that other state data that we referenced that shows that premiums across the board and some states that took nice steps to stabilize their marketplace are in fact going down. Make sure you like this video and subscribe to stay up to date, especially as open enrollment continues.